How does abscess drainage treat diverticulitis infection? Imagine a small pocket of infection forming in your abdomen or pelvis because of diverticulitis. When this pocket fills with pus, it creates an abscess that can cause pain, fever, and swelling. To treat this, doctors often perform a procedure called abscess drainage. This process involves inserting a thin tube or catheter directly into the abscess to remove the pus. The goal is to physically eliminate the infected material, which helps control the spread of infection and reduces inflammation. This drainage is especially important when the abscess is larger than 3 or 4 centimeters. Antibiotics alone might not reach deep into the abscess cavity to clear the infection effectively. Using imaging tools like computed tomography scans or ultrasound, doctors guide a needle or catheter into the abscess through the skin. This minimally invasive approach allows the pus to be drained without the need for open surgery. As the pus is evacuated, pressure inside the abscess decreases, bacterial numbers drop, and symptoms like pain and fever often improve quickly. By removing the infected material, abscess drainage helps stabilize the patient and prevents the infection from spreading further. It also provides a window of time for the inflammation to settle down, making subsequent treatments safer and more effective. In many cases, especially for patients who are at high risk for surgery, this procedure can serve as the main treatment, sometimes avoiding the need for more invasive operations altogether. However, draining the abscess does not cure the underlying diverticulitis itself. The disease in the colon may still be present, and there is a chance that abscesses could form again in the future. Sometimes, patients develop complications like fistulas, which are abnormal connections between organs. Because of this, doctors often recommend elective surgery to remove the affected part of the colon after initial recovery. This surgery helps prevent future episodes and complications. In summary, abscess drainage treats diverticulitis infection by physically removing pus from the infected pocket, which controls sepsis and reduces symptoms. It helps stabilize the patient, often avoiding emergency surgery, and acts as a bridge to further treatment if needed. In some cases, especially for high-risk patients, it can be the definitive treatment. This approach is supported by current medical guidelines and studies showing that minimally invasive drainage improves outcomes and reduces the need for urgent surgeries. Always remember, each patient is different, so personalized medical advice from a healthcare professional is essential to determine the best treatment plan.